Hello, welcome to the School Linked Partnerships and Capacity Grant 101. My name is Liz Gomez, and I'm with the Sacramento County Office of Ed Capacity Grants team. We wanted to walk you through some of the 101 as it relates to the capacity grants. All right. So the School Linked Partnerships and Capacity Grant is part of the Children and Youth Behavioral Health Initiative, which is a $4 billion initiative from the state of California in investments in school and student behavioral health. There are a number of different state partners associated with the Children and Youth Behavioral Health Initiative, including DHCS, HCI, CDPH, amongst other partners. The School Linked Capacity Grant is a $400 million investment that is led by the Sacramento County Office of Education and the Santa Clara County Office of Education, and the funder is the Department of Healthcare Services. The program's goals are threefold. Increase the number of local education agencies that can access reimbursable funding sources, expand access to behavioral health services, and develop or enhance collaborative infrastructure. In other words, the grant program, which is allocated to all 58 county offices of education, builds readiness in the form of provider capacity, partnerships, and infrastructure to school-based funding sources, which are inclusive but not exclusive to the multi-payer fee schedule, which is a new funding source designed to be an approachable reimbursement model. So there are a couple different areas that county offices of education and LEAs are able to spend their capacity grants dollars on. Here you can see a breakdown of statewide what the priorities look like. So there's 5 priority areas. The first is service delivery infrastructure and capacity building. So you can see the 42% there in green. This is a big priority across the state. This is what you can think of as the people and the places. So the people on school campuses that are providing trusted services to young people, and the places that they can go to receive these services. The second area that you can see here in pink is data collection and documentation. You can think of this as when a young person might go to seek services and a staff member, maybe a clinician, provides, let's say, a psychotherapy session and needs to document the session that they provided. So that's that documentation piece. This documentation might happen in a system, let's say an electronic health record system. So that is, as we think of data collection and documentation, you can see statewide 14% of the funding is going towards this area. The third area is billing infrastructure. So let's keep walking alongside this young person that received psychotherapy services in a wellness center on campus. They had a clinician that documented those notes, and then they want to send a claim in for that service. They need billing infrastructure in order to send that claim in to seek reimbursement. So that's that 15.8% of billing infrastructure. The fourth area is called collective impact. So collective impact, as it is stated, is where COEs and LEAs are considering how they partner with managed care plans and community-based providers, their county behavioral health service departments. We know that this work doesn't happen alone. It doesn't happen in silo. So this is a section of funding that is dedicated towards that collaboration. We've got administrative costs, and then we have other. So other is an area that COEs and LEAs are able to outline a funding area that may not fit nicely into our existing categories, but still aligns with the overall goal of the grant program. And then finally, on the left-hand side in blue, you can see Medi-Cal enrollment at 4.7%. For a priority for COEs and LEAs. So we thought it could be helpful to walk through the biggest area of spending, which is service delivery infrastructure and capacity building. So the top three areas that were selected under service delivery is training staff to deliver evidence-based interventions, covering travel costs to participate in relevant training, and hiring and contracting with eligible providers. So those are some of the supports for the people. We talked about the people and the places in this area. And then the second bullet, you can see that 26 COEs and 293 LEAs at the time of pulling this data are building, modifying, furnishing, or preparing physical spaces to create rooms for on-site provision of behavioral health services. And then finally, 4 COEs are hiring certified wellness coaches as of when this data was pulled. So we'll dig a little bit deeper here. We're going to talk about Del Norte County Office of Ed, which is spending 18% of their dollars in service delivery. So Del Norte has some work that they're doing in this area. They are reviewing a draft MOU with United Indian Health Service to provide culturally relevant health services in their school. They signed an MOU with Open Door Community Clinic to expand behavioral health services for students. And they are in partnership with Daybreak, a school-based mental health organization that provides in-person and teletherapy services to students. So we just wanted to provide you an example in practice of what this area looks like in one community. Here you can see the Del Norte COE Mobile Wellness Center. And this is really cool because we have, this was initially invested in through SB HIP funds. And then they have continued that investment and partnership with the Capacity Grants program. And they are also working to start billing the fee schedule. So this wellness center is right at the center of what it looks like to braid funds together in a county. So at the beginning of this presentation, we talked a little bit about building capacity to access reimbursable behavioral health services funding for students. And there are lots of different types of funding sources that COEs and LEAs are working to access. Listed here are a couple of those areas. The Expanded Learning Opportunity Program, also known as ELOP, LEA BOP and ESMA, the fee schedule, which we spoke about earlier, Enhanced Care Management, or ECM, and Specialty Mental Health Services. So these are some of the funding sources that we have been talking about as a community as it relates to COEs and LEAs braiding together different resources to sustain the student behavioral health ecosystem. Within the capacity grants, we are grounded in the goals of the grant program, and we envision a future where every child and youth in California is celebrated, nurtured, and supported by caring adults at home and at school. Our mission is to support COEs in building the infrastructure and capacity to meet the behavioral health needs of students in their schools and school districts. This work is guided by a commitment to increasing equity through changing existing systems, policies, and practices to ensure that all students have full and complete access to culturally and linguistically responsive behavioral health services. Our outcomes are increasing capacity, infrastructure, and partnerships, expanding access to behavioral health services, and collaborative infrastructure across LEAs, MCPs, managed care plans, county behavioral health departments, and community-based providers. Now, how do we do that? What does that work look like in practice? So Sacramento and Santa Clara, as the grant leads, partner with the 58 county offices of ed. We also have a regional leads framework. So there are 7 regional leads that work with the COEs in their region. And each county office of ed works with their LEAs and charters to support capacity building in their community. In terms of the specific programming, we have communities of practice and office hours. So communities of practice happen once a month, where we spotlight a promising practice and are in discussion with one another about what that looks like in our communities. Every Friday, we have office hours, which is focused around peer learning and information sharing. And then going up in purple, we've got our peer learning communities, which are topic specific. The two peer learning communities we have right now are workforce and billing consortium leads. And then we've got work groups who work on a specific area for maybe a specific period of time. We have a work group working on a documentation toolkit, as well as SEL in Tier 1. And then finally, our region leads, which do region-specific support and dialogue. All right, so we talked a little bit about the different program areas, and then here we're going to talk about the specific subject matter experts associated with those program areas. So we do have a lead within clinical documentation. And a lead, I mean a human that works on the team that you can connect to if you have any questions around this area. Social emotional learning, workforce, charter schools, expanded learning, and progress reports and data requests. So there is a person associated with each of these areas should you have questions or want to reach out or connect and engage in peer learning. And this technical assistance all ties back to our strategic plan. So one of our priority areas is to provide technical assistance to support COEs to build their own capacity and build the capacity of LEAs in their counties to provide behavioral health services for students. And so we do that through a lot of what you saw in previous slides in that pyramid, a number of different program areas, a number of different subject matter experts to meet the needs of counties. We are also in the midst of a couple of different themes based on feedback from county offices of education in our strategic planning process. We're right in theme 1, which is building family and community of trust, including gathering insurance and consent and addressing mental health stigma. The timeline for that is February through April. We care about this because this is an underlying issue behind challenges with communication and information collection and supporting communities and having access to school-linked behavioral health services. Our next theme, which is just around the corner, is Tier 1 and universal supports. The timeline is May through August. This theme relates to wellness coaches, SEL, medical necessity, and integrating the medical model into the school model. So you'll see more programming have a focus on this second theme in May and August, May through August. And then finally, our third theme is youth and community voice, including culturally sustaining practices for September through December. Everything we are doing depends on youth and marginalized communities showing up and engaging in services. If we create systems without them, we are less likely to succeed. All right. So with that, really appreciate you all tuning in today to the Capacity Grant 101. Don't hesitate to reach out if you have any questions. Don't hesitate to reach out to capacitygrants@sccoe.org, and we're happy to connect at any time around whatever needs you might have to feel most supported and welcomed into the grant program. Thank you.